Hello and happy Friday. I seem to be getting a similar question often these days, and patients often ask if I've had a prior filler or if I've had a prior energy-based device like focused ultrasound or maybe radiofrequency devices or even some of these high-frequency electromagnetic treatments. Would that complicate my facelift? Now, I will just tell you that that's a debate that's going on that has not been established as a clearer answer yet, but here's my take on this. So there was a recent article in the Aesthetic Surgery Journal Open Forum that said that of those surgeons that perform facelifts, 52% thought that the biostimulatory fillers would make the facelift more difficult, maybe a little more complicated, and possibly a bit more dangerous. Now, what that means is that the concern was that we were seeing more nodules, we were maybe seeing a decrease in the blood supply, we're maybe even seeing a decrease in the longevity of that. So I will tell you that I don't necessarily believe that. I have not seen that in my practice. I do a lot of facelifts. I do a lot of facelifts under that circumstance where people have had prior treatments. So I will personally say I don't think that there's a concern here. Now, let's do a couple points of clarification. What is a biostimulatory filler? Well, a biostimulatory are kind of usually described with Radiesse or kind of coincidentally wearing Sculptra, where they work by working under the skin to incite a certain amount of inflammatory process that's very small and subtle, but it gives you collagen formation itself. So you essentially build your own collagen. That differs from fillers like hyaluronic acid fillers like Restylane or Juvederm, where the volume that you receive is really from the filler itself. So is that stimulatory process from these biostimulatory fillers causing more fibrosis in those layers that we're now trying to later dissect? So I'll just say that I don't believe that's the case. It really seems to be that it might take a tiny bit more time. It might take just a little bit more energy to kind of open those spaces. But again, I don't think it compromises your results. Why is that relevant? Well, the American Academy of Facial Plastic Surgeons, which is what I belong to as a facial plastic surgeon, has shown that in another study that since 2019, every year, those surgeons, 90 to 95% of the surgeons feel that they're seeing more facelifts year to year. And in particular, we're seeing that more in that 35 to 50-year-old category. So not only are facelifts getting younger, but the other part is that happens to correlate with the same patient population that tends to do a lot of these fillers beforehand, or they tend to have biostimulatories, or they tend to be invested in some of these other non-surgical choices before advancing to, let's say, their facelift. So it is relevant and it is growing. And so it is something that we do see come into the office more and more as a question. So in the end, I'll tell you, I don't think it's relevant. I don't think for somebody that does a lot of these surgeries, it's not something that they're going to be too concerned about. They'll note the difference for sure. We see it in the operating room. We do know it has taken place. But in the end, it doesn't compromise your results. So if you're considering that a facelift and you've had these before, just make sure your surgeon is aware of that, because he or she will benefit from knowing going in. But again, don't worry about the results.